Welcome back to the Nancy Skills Hub Uganda. Thank you for liking and subscribing to this channel. Thank you for liking the videos of hand washing where we had routine and surgical hand washing. Today we are bringing to you decontamination. Decontamination is the process of making objects safer to be handled by healthy workers. And today we are going to be looking at the 4-bucket system of decontamination. And the procedure is as follows. We're going to first check our buckets for appropriate labeling. So we have the soapy water, the clean water or plain water, jik, and then the plain water. We are going to don on our personal protective equipment, for example the gumboots, so as to protect ourselves, to prevent microorganisms from splashing onto the uniform. We are going to add the apron to protect still our uniform as we are mixing our jig and as we are carrying out the procedure, so as to prevent cross infection. We are going to set our bucket for jig first, and then we are going to check our concentration, and in this case we are going to use 3.5% jig. We are going to first make the concentration of the desired jig needed for decontamination, and that is 0.5%. We're going to pour 1 part of jig in the bucket and add 6 parts of water to make a concentration of 0.5% jig, which we are going to use for decontamination. After mixing jig, we are going to prepare soapy water. Remember, it is soapy water first. When we are dealing with the 4-bucket system, we are going to pour our liquid soap into the bucket of soapy water. After, we are going to wash our hands. We apply soap and wash hands routinely. From the previous videos, we have seen routine hand washing. So we are going to follow the steps of routine hand washing before we put on our gloves. We are going to put on the heavy-duty gloves. Remember, in decontamination, we are handling soiled equipment which are prone to cuts, so we are going to be using our heavy-duty gloves. We shall pick all the items which were used in a surgical procedure and carefully put them in a bucket of soapy water. We are going to pick up the brush to be used for scrubbing. We are going to push the bucket closer. We are going to pick one instrument at a time as we scrub it clean with our brush. Making sure that every angle is cleaned. Those instruments which are locked, for example the forceps, we are going to open them and scrub them effectively. After scrubbing, we immerse all our instruments in a bucket of plain water, rinse them. After rinsing our instruments, we are going to hold them on a receiver because decontamination we calculate the same time for all instruments. So we are going to immerse them at the same time, and we are going to wait for 10 minutes for effective decontamination. After the 10 minutes have elapsed, we are going to pick the instruments out of the jig and we are going to rinse them in plain water. We are going to open our instruments after rinsing them in a bucket of plain water and put them on a tray to be air dried. We are going to place item per item, one at a time on the tray, and after, we are going to remove our heavy-duty gloves. We are going to perform hand washing after the procedure, and still we are going to follow routine hand washing as we discussed earlier in the previous videos. For those who didn't see, you can still check back on this channel. Routine hand washing. After hand washing, we are going to remove our personal protective equipment one at a time. We're going to remove our apron. Next, we are going to be removing our gumboots. And after, we shall leave the sluice room. Points to remember. Remember not to use the decontaminated instruments for a sterile procedure because they are not safe to be used. After air drying the instruments, remember to pack them in their individual drums and take them for sterilization and prepare them for the next surgical procedure. Stay tuned on the Nurses Skills Hub Uganda. Thank you for liking, subscribing, and sharing the videos as we bring to you more nursing and midwifery procedures.